second in my series about my own personal experience of having fallen a victim, a patient to COVID-19 coronavirus disease, and having suffered from it and having recovered from it. So in this second my talk, I will be talking about symptoms. Now, there are two things, symptoms and signs. Symptom is or symptoms are what the patient feels. Signs are what the physician or doctor finds out in the patient. So I will say that coronavirus disease is all symptoms and treatment. And there are very few specific signs for the coronavirus disease. It is between the symptoms and the investigations. And I would say that maybe the doctor is just left to decide the proper treatment depending upon the severity of the disease and to apply the proper protocol of the disease. And maybe it will be better if this disease is diagnosed and treated by robots, which are tuned to the proper protocols depending upon the patient's symptoms and investigation results. So, before I start this thing, my first talk was, which you can find on my channel, was on the fears and panic of coronavirus. And out of that, what I told was very important role is played by the friends and the relatives. So I would like to say thanks to the anesthetist associated with me, Dr. Kuldeep Singh, who rang me up regularly every day and guided me through the treatment. And even I got some changes done in my treatment as per his guidance. He had also suffered from this disease, a bit more severe than me. And then Dr. Anupam Watts, my class fellow of my medical college, who rang me up regularly and encouraged me. My wife and my Nita Dewan, my son, Dr. Parth Dewan, and many others who called me, a long list. So, coming back to this talk, that is symptoms. So, now it is more than a month, about a month and a half. And then I had recovered about month, you know, uh, half 15 days back, I recovered fully and my COVID test became negative. So, what were the symptoms? Now, it's important for you all to suspect that when your symptoms are what will be felt by you, by the patient, God forbid you don't suffer, I mean, by the person who will get infected with it. So, what I was going normal, but I started feeling a bit more cold than what I should have been feeling. And that cold came with that when I was watering my plants in my garden. So then I felt that I am suddenly feeling more cold and a bit of shiver. So I left the water and the pipe and came back and I went into my bed. And there I felt a bit of rigor. That's not, thrilling sensation of something vibrating in my muscles, in the legs, and in the things like shivering. So these I thought that it's okay. After some time, it become all right because I warmed myself. So it started with that, and then after few hours, I started having a bit of congestion in my nasal congestion, a bit of running nose, not much, little bit. So then, okay, now these symptoms, running nose, a bit of stuffiness in the nose continues. Then I started having headache, right side after few hours, more few hours. Now this headache, usually if there is small headache with the expected with the stuffiness of the nose and nasopharyngeal systems. So I said okay, but this was increasing and not going with the passage of time. So now three symptoms. First symptom very important, which I had repeated episodes of that over the period of time over 3 4 days, even when I was diagnosed and admitted. So they were like viremia, virus going out from its nidus to the bloodstream. And then The body bacteria or virus or toxins, when they go inside the bloodstream, they cause some reaction, and it was antigen antibody reaction or immune reaction. So the body tries to kill the viruses, and they throw some toxins which irritate the nerve endings, and then the body shivers like that. So that is called viremia, bacteremia, toxemia, septicemia. So this was viremia. Okay, this I had repeated episodes, even continued for 4 or 5 days. In between, they will come and go. And nasal stuffiness increased, headache increased, becoming more and more intense. So I took a Calpol, paracetamol. It didn't help much, and what no fever, no cough. And then I was thinking, okay, it was some bad cold, flu type of thing. And of course, this is also a COVID is also a flu, but it's very difficult to immediately think for the worst. Person likes to think for better and the best. That okay, this something will go off. Well, it didn't go off. The next day, the headache is persisting. The nasal stuffiness has increased. The episodes of chills and rigors have increased. And I found the temperature, I found there was 99.2, not much temperature, but there was a high 98.4 to 5 or 7 can be considered normal, slight mild high temperature, not mild increase in temperature. You can't say it high temperature, low grade fever. Then what else? What else? Then there is coming of persisting, increasing headache. Then the temperature increased. When the temperature increased to 100 degrees, and then I thought, well, it may be something which is the pandemic is going on, and who knows who is suffering, and who knows who is not suffering. And people are coming, patients are coming to me who says they don't have cough or fever or anything. They may be asymptomatic carriers. Somebody might have brought these masks are all flimsy, they are not airtight masks, and that's why the pandemic is taking place, is spreading. Aerosol infection, somebody sneezes and say it's a normal sneeze. I haven't sneezed for years, for ages. That's how this is a very real sneeze. Maybe sneezing every minute or every half an hour. But then they will not agree. Cough, they will say that's just from dust outside. I travel to your clinic. So they will, oh, you are coughing, please go outside. No, no, not so. This just happened now. Well, this is what's something brought. Now we are talking of symptoms. Now, when the symptoms, I isolated myself and I sent for the nasopharyngeal swab for RT-PCR for COVID-19, and I quarantined myself. So these symptoms, they kept on increasing with the addition of fatigue and with the addition of a bit of anorexia, means loss of appetite. So when the temperature went up to 102, and I started having some cough with mucoid expectorations, mild mucoid expectorations, expectoration, you see. Expectorations means some sputum, that something along with the cough will come out like mucoid secretion. So that along with that, I started feeling in the lower chest a bit of pain, and the test hasn't come as yet. But the test came, there was not much fatigue. Then I got myself admitted, and I was still feeling energetic and as if nothing is happening to me except for these symptoms, which are like that of a bad cold or flu symptoms. And so, but due to because I'm a senior citizen and there was some cough, I wanted to get myself investigated. And now, during the period of my admission, during the first day, second day, the temperature went down as they give me antivirals. Antipyretic means anti-temperature, and a bit of painkiller like simple paracetamol, and they started the protocol of anticoagulants and other things. But the symptom of fatigue started increasing, and of course, nasal stuffiness and blockade post nasal discharge means the discharge which doesn't come through the nose but falls in your pharynx, in your throat from behind. That increased, and that you started getting thicker and thicker. So I was taking steam, and nebulizer they were giving me. And as per investigations, all the treatment. As the things progress, the temperature disappeared, headache decreased, and with medicines also they help. But the nasal stuffiness and the secretions did increase, and the anorexia, I started feeling not only anorexia, but some sort of nausea, as if I take food, I will vomit out. They investigated all the investigation. The liver function tests were normal, the renal function tests were normal, all the other tests were normal, and these I will say now I had made a list of it. And another symptom which I wrote down, I forgot to tell you. Extempore talk means you can forget something. So the another symptom was earache. Now there is a tube between the ear, in middle ear, and the pharynx. That tube is called Eustachian tube. Maybe Mr. Eustachian, Dr. Eustachian had or anatomist or somebody had found out this tube by cutting open, doing autopsies on the bodies, and named Eustachian tube. So that the air is a middle ear is a closed cavity. So the carbon dioxide and oxygen is like to be absorbed. So it has to be constantly supplied with the air through the Eustachian tube. When we swallow, it opens, and takes the air in and out from the Eustachian tube. So it gets blocked. And when it gets blocked, the air gets absorbed. The nitrogen is difficult to absorb, but gets absorbed. Carbon dioxide is very quick to get absorbed. Oxygen gets absorbed, nitrogen gets absorbed. Then there is a vacuum. And this vacuum that pulls the structure around the eardrum and the malleoli, so, and the walls and the mucosa of the middle ear. This causes earache, and some secretions come in when there is vacuum from the blood and the mucosa. Some secretions are pulled in, which fill the air, and they may overfill it. So this I ache on the right ear. Mostly I had right-sided headache. The earache, that was very significant. And of course, in the first days and all, I went to my garden again. And again, I started feeling cold. I tried to smell the roses. And I was not able to decide whether I'm getting mild fragrance or not. I think it was reduced. And the taste was reduced, but I couldn't, one is having some this physical discomfort and some psychological stress. So I couldn't really make out this the food is but food had lost its taste. So that loss of taste and loss of smell is of course there. Running nose, sneezing, yes, sneezing. That frequent sneezing in the first days. Cough and this and sputum, headache, fatigue, earache, loss of appetite, and loss of smell, and episodes of shivering. And as I started recovering, and the things became my D dimer and other things became normal, and my TLC has increased. So that is TLC increases with some bacterial infection because they gave me corticosteroid starting from the first day. Maybe this caused some infection into my lungs. Already, we all have a lot of bacteria sitting down in our body everywhere, on the skin, in the nasal pharynx passages, in the intestine. When our body is weakened due to anything, maybe corticosteroid, they are opportunistic infections. They attack. Like the fort is there with its walls, and there are already people outside, which are normal people, or they are dacoits or burglars or thieves or whatever. But normal people also, if the walls of the fort are broken, so they also attack as burglars or thieves or dacoits. So these are opportunistic elements are always in our body, which our body when becomes weak, like I was given corticosteroid, but TLC became all right. So then they discharged me. In the home also, the symptom, in addition to the symptom, was a psychological symptom of feeling of loneliness, of feeling of not being able to go to work, not able to do the routine uh, to what you are used to every day, and a bit of in between, a sort of it will cause if there is some anxiety, I think everywhere, because especially when it get transmitted, like my wife had lost her mother, my mother-in-law had fallen victim to coronavirus, COVID-19, about 3 months back. She was admitted in NIMS at Jaipur, and they had not given her stopped anticoagulants. Well, I also had requested them to continue it after my friend suggested and that the anticoagulants should be given. So, but then she had expired after having gone through all the procedure of getting admitted as almost a normal person, then going on YPAP, and then going on ventilator, and you know what happened, whether it's thrombosis, thromboembolism, or whatever it was. So there was that my wife was too much panicking on that aspect because I was now admitted or suffering. So she just wanted me to come back, and she was not able to talk to me regularly because she was panicked and like so will get transmitted. So these are other aspects of symptoms. The main symptoms when you have these days a continuous headache, running nose, fever, sneezing, cough. Don't wait for loss of taste or loss of smell. Get a COVID test done. Any cough, any running nose, any headache, fever. This is pandemic age for coronavirus. Earlier your treatment starts, and earlier your good nutrition and good care, taking regular steam, regular gargles and other things start. So give importance to the symptom. There are no signs here. Hardly any doctor will see your throat or nose or auscultate your chest or palpate or percuss your chest. No doctor is doing this. This is just your symptoms, your investigations, and your treatment. So pay heed to your symptoms and get proper investigations so that you can be put on the proper protocol of treatment. That's about this lecture. If you like it, get benefit from it. Press the like button and share it with your friends and subscribe to my channel. And I will give you the next talk on when to have and where to have tests and how to isolate or quarantine yourself at home. I shall see you again. Okay, bye bye for now.